All right, so I am, before I go into the room, I'm going to gather all of my supplies and I'm going to go into the room and then I'm going to perform my aided. So I'm going to acknowledge the patient. Hi, Miss Smith. My name is Shannon. I am going to be your nurse today and I am going to be doing an exam on your head, eyes, ears, and neck, and mouth, and throat. So it should take about 15 minutes or so. Do you have any questions before we get started?
No, thank you.
No, okay. Can you verify your name and date of birth for me? So she's verifying her name and date of birth, so two identifiers. I have my supplies here. I'm going to perform my hand hygiene. Normally I would wash with soap and water. And then I am going to ask the patient a couple of introductory questions. So, do you have any previous history of mouth sores? No. Do you have any issues with your hearing? No. Okay. All right. So the first thing I'm going to do is we're going to examine inspect the head and the skull. So we are going to do a visual sweep and just look at the head and the skull. Put my gloves on because when I palpate the scalp and rub my fingers through her hair, then I would want to have on gloves for that. So just upon a visual examination, I'm going to look for any discoloration of her skin, any pigmentation, any erythema, and then I am going to look through the scalp. So I'll palpate her scalp, trying to feel for any lumps or bumps or any areas that are tender to the patient. Does anything hurt? No? Okay. And then after I'm palpating the scalp, I'm going to document if I feel any tenderness, which she denied she has any of that, and I don't see any sores. And then also I am going to look at her skin on her face and look for anything such as rashes, any discoloration on her skin, on her face, which I don't see any. The next is the TMJ joints. So, which is the temporal area. I will palpate this area right above the cheekbone between the eye and the top of the ear. So right here I palpate, and then I will ask the patient to open and close their mouth for me. Open. So just checking range of motion, if you can open your mouth and close it like. Okay. Also, upon inspecting the TMJ joint and the range of motion, I am going to be looking at asymmetry of the patient, and then also noting if I notice any crepitus or popping of the joints of her TMJ. So next, I'm going to inspect and palpate the lymph nodes. So, and with the lymph nodes, I am going to be looking to see if there's any nodularity, any inflammation, or a tenderness when I palpate each of the lymph nodes. So the occipital lymph node is located down at the base of the skull, so I am going to palpate bilaterally the occipital. Then there's the pre-auricular lymph node here, post-auricular lymph node here, the jugular digastric lymph node, which is the angle of the mandible, And then there is the submandibular, which is just a little bit lower under the mandible. Then there is the submental. The submental, which is located right under the center of the chin. And I don't notice any abnormalities so far. You okay? And then there is the deep cervical chain right along the SCM muscle here. There is the subclavicular. Right, we'll put my fingers right under her clavicle bilaterally and palpate there. And then the superficial cervical, which is posterior to the angle of the mandible, and submental SCM joint. Next is going to be the sinuses. So I will palpate bilaterally the sinuses and note if I see any or notice any tenderness there, which I do not. When I'm inspecting the sinuses, I'm going to be really careful to avoid the eyeballs, just not to poke them or injure them in any kind of way. Next is going to be the cervical spine and the neck and the thyroid and the trachea. And upon examining the spine, I'm going to look to see if it's erect, if it's asymmetric, if it's curved, if there's any atrophy, anything like that. So just doing like a visual sweep of the spine. And if you wouldn't mind turning around, we're going to test the range of motion for her. So we are going to ask if you can touch your chin to your chest like this. Are you able to lift your chin towards the ceiling like this? Okay. Are you able to move your head side to side? Other side. Okay. And then if you can turn your chin like this towards each shoulder. Okay. All right. Next, I am looking to see, looking at her thyroid here. So I am going to, it's my pen light. Can you please move your head up a little to the ceiling like that? So if I have my pen light, I'm going to visually inspect the thyroid. I am looking also at the trachea. So I'm going to put my index finger on the trachea and palpating to see if I notice any nodules. I'm going to ask the patient if it's tender or if I feel any abnormalities in that area. And I don't see any tracheal shift or any other abnormalities there. Next is going to be the eyes. So I am gonna look with my pen light in the eyes, looking to see if I see any abnormalities there, such as clarity, opacities, anything like that. Also going to be looking at the eyelids.
TV.
Oh, Donna, please. I am going to ask the patient if they wear glasses or contact lenses. Do you wear glasses or contact lenses? No? Okay. I'm going to look at the iris. So I'm going to be looking the center of the eyes with my light, as well as her pupils. I'm going to note like the diameter of her pupils, and document if I see any abnormalities there. In addition to the pupil size, I am also going to look to see if they are equal, reactive to light, if they are round, and then so I am going to ask the patient, I'm going to stand in front of them, I'm going to ask them to focus on an object. Can you please focus on this object, which is a short distance away? You see? Okay, and then I am going to shine my pen light and look at one eye, measure their pupil, and then I'm also going to do it with the other hand, so switch hands, and then I'm also going to look at her pupil on the other side as well. And document any irregularities that I see. Then I am going to inspect the corneal light. So then I'm going to examine the external structure of the eye. So I'm going to be looking at the lacrimal duct, and then I will gently just pull down on the lower lid to notice if I feel any masses there, or any redness, tenderness, irritation, inflammation, or anything like that. And just make sure that I'm doing it very gently so that I don't poke them in the eyeball. Also, we'll be looking at the conjunctiva and the sclera, doing the same thing, and noticing if I notice any of those same abnormalities. Looking with my light, which I do not. Next, I am going to do the smelling test to see how their vision is. So basically, I would have my patient stand from 20 feet away from the chart, ask them to cover up one eye, and then point to each letter and ask them to read the smallest letter that they can read from that chart, and then document the results of the smelling test. With the extraocular function, I am going to be 12 inches away from the patient, and then just ask them to follow my pen light. Can you follow my pen light? Here I would note any nystagmus, which I do not notice. Next, I am going to examine the patient's ears.
Is this your like actually your lights?
So, for the ears, I am going to have my before I examine her ear with the otoscope, I am going to just examine the outer ear and look to see if I see any crusting or scaling, looking at the skin to see if the skin is broken or disrupted, or any of that, which I don't see. And then I'm just going to have the patient slightly tilt their head the opposite direction of me, pull up on the pinna, up and back, and then I am going to insert the otoscope downward with the speculum, and then make sure that I have a clear view of the eardrum. So it's important to make sure that there's no cerumen in the way so that you can visibly see the eardrum fully. If you cannot see the eardrum fully, then you would need to flush the ear out so that you're able to do that. And then I will repeat that on the other side. I could document if I notice any swelling, irritation, redness, or like I said, impacted cerumen. All right, and then next is going to be the hearing test, which is the whisper test. We would do that. Um, Basically, I will.
Wait. Shh. I have to do it Thank you.
So for the whisper test, I'm going to make sure that I am 2 feet away from the patient, arm's length, and I'm going to push on the tragus and in and out of the auditory meatus, and then I am going to move my head a little closer to the patient and slowly whisper 3 different letters and or numbers, and then I'll ask them to repeat that back to me. So let me know if you can hear what I'm whispering, okay? Can you repeat those, what I just said to you?
What did you say?
So I would document if they had heard all 3 or 1 or 2 of the 3 letters or numbers that I had said. Document the results, and then I'm going to repeat that on the opposite ear. Next, I am going to inspect the nose, the external nose. I'm going to look to see if there's any redness, inflammation, irritation, any sores, swelling, anything like that. And then I am going to check for patency. So I'm going to ask the patient to cover up one nostril like this. Can you smell through your nose? You can? Okay. Are you able to switch and cover up the other nostril? And take a breath in. And can you breathe through your nose? Okay, so I'm going to document that for patency. And then I am next going to inspect the internal nares. So I will use my otoscope to look up. If you can please put your head up a little to the ceiling like that, and then use my light to inspect the internal structure of the nose, and look for any deformities there. If I would see a deviated septum, I could note that, or any other abnormalities, which I don't see any. I would look to see if there's any abscesses in there, any sores, which I don't see either. Next, I am going to inspect the mouth and pharynx. So I will, I would change my tip on my otoscope, but I would ask the patient to open up their mouth, and then I am going to open up your mouth. So at this point in the exam, I will want to have my tongue blade. It's not sterile, so I won't actually stick it in her mouth. But I would use a tongue blade to depress the tongue and look at the back of the mouth and the pharynx. I would also use my pen otoscope to see if I notice any abnormalities in the back of the throat, if I see any sores in the mouth. If you can do this with your tongue. So I'm going to also look under the tongue, look at the veins under the tongue, and make sure everything is intact there, which it looks like it is. And then I would also push against the buccal mucosa on the inside of the mouth, and inspect that whole area as well bilaterally. So in addition to the tongue, and noting the appearance of the tongue, it should be a beefy red color, but it could be another color. In addition to the tongue, I'm also going to be inspecting the teeth and the gums to make sure that's all intact. If they're missing any teeth, I would note that. Any malocclusion on the teeth, I would notice that. Any bleeding of the gums, gingivitis, or any other disease of the gums, I would document that as well in my exam. And then just looking at the hard and the soft palate. Can you push up with your tongue like this? So just asking the patient to push up on their hard palate with the tongue, and then again looking at the veins under the tongue um, as well. I also ask the patient to open up wide. Stick your tongue out. So I'm looking at the uvula in the back of the throat. I'm looking at the tonsils. Make sure that is all intact. If I would notice any nodules, any white patches on the back of the tonsils, I would note that as well. Ask them if they're having any pain, if they have any sores or lesions in their mouth, I would note that as well. So after the exam of the throat and the mouth, that would conclude my exam. Thank you for allowing me to examine you today. I am going to go and get your doctor. Do you have any questions before I leave?
No, thank you.
All right. So then I would just thank the patient, gather all my supplies, clean that all up, perform hand hygiene once again, and then that would conclude the exam.